Hello, Rihan. Welcome. Make yourself comfortable.
Thanks, Helen.
My pleasure, Rayhan.
What do you do for your living?
My work involves lifting heavy weights. Recently, I noticed a large swelling in my right groin which is quite painful and is affecting my work. The swelling becomes bigger on coughing and straining and reduces on lying down.
Your symptoms suggest a groin hernia. Do you smoke or have any health issues like a cough, breathlessness, asthma, constipation, or trouble urinating?
No, I've never smoked.
I don't have any chronic cough or lung issues. My bowels are regular. I've been having some issues when using the toilet. I'm waiting for an appointment with the urology team next month.
You should prioritise this, as it might impact your treatment.
Sure, Helen.
What is hernia?
It's stopping me from working.
Our tummy contains important organs such as bowel and urinary bladder, which are protected by abdominal wall, which is formed by a sheet of strong muscle. Inner lining of the belly called peritoneum, which keeps the organs moist, fat cushion under the skin, and skin itself. An inguinal hernia occurs when contents inside the belly, such as the intestine or abdominal fat, protrudes through a weak area in the abdominal muscles in the groin area.
This weakness could be present by birth called congenital hernia.
The testes on both sides in males originates from within the belly when the baby is in the womb of the mother. As the pregnancy advances, the testes on both sides descends in to the groin, passes through a gap in the muscles called inguinal canal, and both testes reach scrotum before birth.
This gap or passage through the groin eventually obliterates, leaving no space behind. In small number of people, this space fails to obliterate, leaving a gap, which may allow the contents like bowel to pass through.
This hernia is called indirect inguinal hernia.
What if I decide to watch and wait, Helen?
Rehan, this is an option, but I must warn you about the risks.
A groin hernia can trap the bowel, leading to scarring that makes it hard to push back.
This painful condition is called incarceration of hernia.
The bowel can get blocked, causing obstruction or lose blood supply, leading to strangulation. Patients may arrive at the emergency department with severe tummy pain, a swollen belly, and vomiting because the bowel contents can't move forward, causing swelling. These conditions are serious and require urgent surgery called a laparotomy, which involves a large cut in the belly to fix the issue.
This is really frightening, Helen. I would rather go for an operation.
Sure, Rian.
A groin hernia operation can be performed using either the open method, involving a 3-4 inch cut in the groin, or the keyhole method, which uses 3 small cuts in the belly.
For hernia on one side, either method works. Use laparoscopic repair for hernia on both sides and recurrent hernias.
Open hernia involved making a large cut in the groin, division of tissue layers to expose the groin called inguinal canal.
The hernia is identified and separated from the sperm carrying tube, which is protected during the operation.
The contents of hernia, like bowel or fat, is pushed back into the belly.
This hernia is then cut and removed. The weakness or gap is then closed with some stitches, and an artificial sheet of polypropylene is placed to cover and strengthen this whole area.
Once the mesh is placed, all the divided tissues and skin are closed again to complete the operation, and the wound is dressed.
In the keyhole or laparoscopic operation, we make 3 small holes in the belly.
These hole sizes range from 5 mm to 10 mm. The location of the cuts may differ from surgeon to surgeon, but most give only 3 cuts. Then, gas is insufflated to create working space to perform hernia operations safely. We introduce stiff tubes, which allow the introduction of fine instruments to perform surgery safely. These stiff tubes, called ports, allow control of gas in one direction. All the action takes place behind the hernia from within the belly in front of inner lining called peritoneum. Therefore, it avoids any cuts on the tissues or muscle in the front. It involves pulling the hernia back into the belly and placing the mesh behind the muscles but in front of the inner lining of belly called peritoneum. As peritoneum can be peeled off in a wider area and a larger mesh can be placed, this technique helps in covering other holes around the groin like femoral defect, hence reducing the risk of other hernias. This peritoneum, along with some small screws, keeps the mesh in place. The ports are inserted in the tummy, belly fat entering the hernia is pulled back, and the inner lining called peritoneum is cut and carefully peeled off like a curtain. All the attachments, including sperm carrying tube called vas deferens and the blood supply to testes called testicular vessels, are freed off from the peritoneum. The peritoneum is then either completely pulled back from the hernia or divided completely. The process of peeling off of the peritoneum continues downwards and on all sides, creating a large space enough to accommodate a large sheet of polypropylene mesh, which is placed in front of peritoneum, covering a wide area around the hernia. This mesh is usually fixed with small screws called tacks to keep it in place. And finally, the peritoneum is closed either with stitches or the tacks.
I've heard about robots doing surgeries. Can our hospital offer this?
Robotic inguinal hernia surgery isn't offered here. It's uncommon due to long operative time, higher cost, and similar outcomes.
Robotic surgery uses robot arms to replace human hands. These arms are connected to the camera and instruments. One robotic arm is connected to the camera and other arms to the surgical instruments. The surgeon sat on the other corner on console controls precise movements of robotic arm to perform the actual operation.
The camera captures and displays high-resolution images on the screen and to the surgeon control and command centre. Robotic surgery lets surgeons sit during procedures, reducing physical strain and preventing injuries from standing too long.
This benefits the surgeons.
Some friends mentioned they had problems after a hernia surgery.
Hernia operations are safe but have small risks.
Your hernia may return, cold recurrence, with a long-term risk of 1 to 4%. Recurrence risk after open surgery is slightly higher, from 1 to 5% compared to keyhole surgery, from 1 to 3%.
In males, a key risk is injury to the sperm carrying tube, the vas.
This damage risk is under 1% and infertility is very rare. Patients with bilateral or recurrent hernia surgery face higher infertility risks. Another risk is infection, which can be managed with antibiotics. Rarely an operation to remove the mesh is needed, but thanks to better aseptic techniques and a dose of preventive antibiotics before surgery, this problem is now rare. Bleeding, collection of clear fluid called seroma, bruises, swelling in the scrotum is a possibility. Testicular blood supply damage is rare but can cause atrophy or ischemia in less than 1% of patients.
A hernia through small cuts in laparoscopic surgery is rare but needs another surgery to fix.
Injuries to the bowel, bladder and major vessels are rare but serious. They require major surgery to fix. Chronic pain from nerve damage or scar can lower the quality of life. After open surgery, 10 to 15% of patients experience chronic pain, which persists beyond 6 months in less than 5% patients. In keyhole surgery, less than 10% experience chronic pain, with 1 to 3% lasting over 6 months. After surgery, older men with prostate issues may struggle to urinate and need a bladder catheter. Blood clots can form in leg veins, known as deep vein thrombosis, or in the lungs, known as pulmonary embolism.
Oh my goodness. What's next, Helen?
You will get an appointment with the preoperative assessment team who will ensure that you are fit for anaesthesia. There are certain medicines like blood thinners which need to be stopped before surgery and other critical medicines that should continue. Additionally, depending on your health condition, you may get additional appointments for heart scans, lung function tests, etc., with or without appointments with other clinicians, depending on your other health problems. Some patients need optimization before surgery so that they are in the best health to be able to undergo safe surgery with a successful outcome.
Thank you.
You will receive instructions by mail or phone. Arrive for surgery on an empty stomach in the morning. If someone can care for you, you'll likely go home the same day. The total operation duration ranges from 45 minutes to 2 hours, with an average of 1 hour for both open and keyhole surgery. You can eat and drink once fully awake from anaesthesia. We encourage patients to stand up and move around same day. You may feel pain in the groin, nausea, difficulty passing urine and scrotal swelling. We will provide you with medicines for your symptoms. The average time off work after surgery is 4 weeks after laparoscopic and 4 to 6 weeks after open surgery. Resume essential activities the same evening. Remember to take it easy and gradually return to normal household tasks over the next week or two based on how you feel. There's no strict timeline. Avoid activities that add pressure to the belly, like heavy lifting, coughing or running for at least 6 months. You'll receive a sick note and instructions with your discharge summary.
What about driving?
Avoid driving for at least 3 to 4 weeks. Follow-up in clinic is normally not required. Go to the hospital emergency department if you feel really unwell. If you have more questions, please do not hesitate to contact us. Kindly encourage us by subscribing to the channel to help us produce more health-related informative videos.